The views and discussion expressed on this program do not necessarily represent those of the hosts of the program or of WMKV Radio, Maple Knoll Communities, or its staff and management. Discussion of specific points and general topics on this program are not to be taken as specific professional advice.
But we're back with Health Scope, and once again, we are talking today about angina. We're talking about some of the various treatments, including EECP, which is it's enhanced external counterpulsation. My headphones just came apart here. I don't see. That's when you have public radio. You have cheaper equipments here. So there we go. And how this is a possible alternative, a possible treatment that we've been talking about today. And we do have a caller calling in just a few seconds here. But as far as insurance coverage and things like that, I guess this is just as a treatment that's covered just as often as any of the other types of
yes, sir.
treatment.
Uh-huh.
Okay, very good. Well, let's go ahead and go to the phones here and talk with Bill. And so, Bill, are you there?
Yes, I am. I had a quick question for Dr. Abbottsmith. I missed the beginning of the show, and I don't know if you talked about angina in detail, but how do we know if we don't have a family history of let's say, some kind of heart condition, how do we know the difference between like maybe a strained muscle or something like that and the pain that we might feel with angina?
Oh, yeah, that's a very good question. It's very hard to answer. If you talk to a doctor, he can usually ferret it out just by how you describe it. The non-angina pain is generally more localized to one spot or another. It may occur in different areas in the chest at different times in the same patient. And if it's sharp and stabbing, like for a second or two, that's usually a non-coronary pain.
So it's more, I guess, consistent, but to a specific area.
Yeah, and the other thing is, if it's there off and on all day, that's a tip-off that it's not your heart. You know, if you just notice it off and on, and it's sort of an annoyance type of a pain, that's usually not your heart.
One of the other things I remember when I was much younger, and they were trying to teach us in health classes about things like, cardiac conditions and warning signs and everything, is the whole issue of numbness, too. Is angina include numbness or just pain? Again, I missed the beginning of the show, so you may have already talked about this.
Yeah, that's a good point. Usually, numbness is not included in angina, but it is included with a heart attack. We didn't talk much about that, but a heart attack is a more severe pain that's associated with numbness in your arm or in your jaw, and nausea and sweating, weakness, along with it, and weakness and lightheadedness. So it suggests that there's more, your heart's a whole lot more not able to work. You know, it's working far less well than it should. Whereas with just angina, it's usually more of a pain that you can stop and it'll get better. Go ahead.
Well, I do appreciate the answer. Thank you so much for the clarification, and I'm sorry if I asked a question that was already covered earlier. So
I don't think it was. You're okay.
Good. Thank you, Bill. Appreciate the call. 772-9658 or 877-772-9658. We have about 10 or so, 12 minutes left. And that I'm sorry, go ahead.
Yeah, there's one other thing. We didn't talk much about heart failure.
But, right.
But patients who have heart failure, their symptom is shortness of breath or fatigue, okay? That's really basically what it is. They can have swelling, so on. But if they're sort of fairly well controlled heart failure, they're still tired, and and short of breath on exertion. That is an anginal equivalent, we say. In other words, if you have had a number of heart attacks, it causes scarring in the heart where it's not working right. So now you've got a heart that's not able to do what it's supposed to do, and you feel tired and short of breath. That's where EECP can really make a big difference. because it's been shown to improve the exercise duration and time to developing chest pain on a treadmill, and improved outcomes, quality of life outcomes. So it's a very important treatment for heart failure as well, if it's on an ischemic basis.
I see.
Yeah.
Now, early on, we talked about a heart attack, and you said that time is of the essence, and that after so much time, the heart actually, some of the tissue actually dies.
Right.
Could something like EECP, I won't say bring it back to life, but could it generate enough cells to repair some of that damage, or is that damage permanent?
It's permanent.
Okay.
Yeah. It was used to treat cardiogenic shock in the 70s, but now we would recommend opening an artery is the only way to really save the heart muscle from dying. Yeah.
I see. Very interesting. So when you talk about heart failure, then that has not gotten necessarily to the point where part of the heart has died.
Well, no, actually, part of it has died. And we talk about ejection fractions. That's where how much of your blood is squeezed out with each heartbeat. Normal is 50 to 70%. A lot of people have ejection fractions down at 35% or 25% or 15%. So they have very limited reserve, and they're not able to do much because the blood builds up in their lungs. They get short of breath, and they're tired. Their cardiac output is low. And so you can have quite a few heart attacks and still be alive, but you're in the phase of heart failure. And if you have shortness of breath or fatigue, that's an indication that you could be helped with EECP as a way of improving blood flow.
Very good. 772-9658 or 877-772-9658. Bill raised an interesting question about like a muscle pull or something like that. I guess if you've had a history of angina, you'll know if it's angina.
For the most part, you're right. Yeah, it usually comes back in kind of the same way.
Right.
Now, sometimes we're puzzled. We don't know. And then we recommend some exercise test or something. Yeah.
Right. But if it just happened to you one time and you've never had angina before, odds are it's probably not, or...
No, it could be. You just talk to your doctor.
could be the first time.
Yeah, right.
Our number is 772-9658 or 877-772-9658. As someone who is involved in cardiology and kind of the research side of it, what do you see coming down the road? What are the advances you see in the next 5 to 10 years? Is it more on the medicinal side? You talked before about improvements in some of like the cholesterol.
Yeah, there's a number of fronts that are being investigated. One is percutaneous valves replacements where you don't have to do surgery. And then we're doing that at Christ now. We've for people who would be too ill to have an operation, it can be done through the groin. Mm-hmm. The other place where I think there's going to be is great promise, and that's with gene therapy in treating heart failure. We're very hopeful, and repairing the damage of heart attacks and maybe regrowing some heart muscle that's dead. And then there's a lot of improvement in cholesterol management with the CTEP inhibitors, which I told you about, that will increase the HDL to a high degree. Perhaps the most important thing is to get everyone on board to do what's right for themselves.
Right.
You know, stop smoking. Don't let the kids learn to smoke.
Right.
Take the soft drinks out of the high schools. Things like that could be a huge advance.
Not just for diabetes, for all kinds of things.
Yeah,
I'm sure.
Yeah,
yeah. That's well. You mentioned the gene therapy. I mean that's a whole exciting,
right,
interesting area. But we do have time here to sneak in another call here and talk to Marianne. Hi, Marianne.
Hello.
Hi. Thanks for calling.
Yes, I have a question. There was a recent article in the paper about broken heart syndrome. I just joined the show late, so you may have already discussed it, but I would appreciate the doctor's insights on that and whether or not there is greater risk for heart disease if you do encounter that?
Yeah, broken heart syndrome is where someone has bad news or some severe stress. A recent patient of mine had her car hijacked right in front of her, and she got a pain in her chest. She went to the hospital, and her heart is now squeezing out only about 30% of the blood. And we think it's due to a sudden surge of adrenaline that taxes the heart in some way, overstimulates it to where it's not working well. And that's got a great prognosis. Within 2 or 3 weeks, the heart's usually back to normal. And they do very well, but they act and look like a heart attack. It's just that the part of the heart muscle that's not moving is not in the same not in a territory of a single coronary artery. So that's how you figure it out. It's called Takotsubo. It was a Japanese doctor who described it, Takotsubo syndrome. But that shouldn't. That you should recover from that almost completely in most patients, and it should not bring. You're not likely to have it again necessarily.
Okay.
Mary, does that answer your question? Do you have any other additional questions?
Yes, that does. Thank you very much.
Okay, thank you. Thanks for calling.
Uh-huh. All right.
Yeah, we're kind of rounding up the end of the show here, but that is, I would imagine that kind of a sudden surge of the adrenaline could kind of send things cattywampus, as they would say.
Right.
But that in that situation, it's your body can overcome that in a matter of days or weeks. Usually. So very good. So in kind of a conclusion, or to kind of round things out here, what are some of the messages that you would like to leave people with in terms of angina and how what they should do if they think that they have this situation? See their primary care physician. Go see you directly at Ohio Heart, or what sort of steps should they take?
Yeah, I think they should see their primary care doc first and learn what they can do, what they're not doing to improve things. But if they have high blood pressure, high cholesterol, physical inactivity, smoking, and obesity, those are the things that they need to work on in order to prevent heart disease. And we recommend 2.5 hours a week of physical activity where you're a little short of breath but still able to talk.
Right, there's cardio exercise,
Yes.
and there's muscle building exercise. You
Right.
specifically the cardio exercise where you
Right.
you get that you get exhausted, you're
Yeah.
breathing hard, you feel
Yeah.
your heart beating.
Exactly, yeah. That's where you're increasing the velocity of flow across those endothelial cells, and you're training them.
Okay.
And then if you have had angioplasty or bypass surgery and are still experiencing chest pain, then and have tried all the different medications, then ECP is an excellent treatment for angina and for heart failure. And you can call 792-7826. That's our number where our coordinator, Doris Osborne, is.
Okay.
792-7826.
And we'll have that phone number at the
Okay.
front desk, 792-7826 here in the 513 area code. And, of course, you do have the website, www.ohioheartandvascular.com. And if you go to /health resources, you can get some more information as well. And, again, examine your life a little bit. I mean, if you are smoking, there's so many reasons why you should quit. I mean, it's not just angina. It's not just, there's just so many reasons. Eating healthy, exercise. I mean, it's not that complicated, is it?
Well, it is. It's awful complicated for someone who can't stop.
That's true. That's true.
And I don't know what the incidence of addiction is, but it's pretty high.
Right.
There's some people just cannot stop,
Right.
So we can't. Our goal is to not let them start, right?
Very good. Very good. Well, Dr. Charles Abbottsmith, thank you so much for coming in today. We really appreciate it.
Well, thank you very much.
And I hope our listeners got some more some information here today. And if not, perhaps you can seek some more. Again, you can call at Christ Hospital 513-792-7826 or www.ohioheartandvascular.com. /health resources. I'm Mike Martini. Thanks to everyone who called in today for Health Scope, and we invite you to call in again next week for Health Scope and our next topic a week from today.
You've been listening to WMKV Health Scope. Join us again next Monday at 1 p.m. for another edition of WMKV Health Scope on 89.3 WMKV, Reading, Ohio.